Hello, I'm Jeff Gold, and thanks so much for being with me today. I've recently had a number of questions from some of our faculty, student, and staff about some of our planning for fall semester. So I thought I'd take a few minutes just to answer those questions and hopefully to be reassuring. As many of you know, as recently as several weeks ago, we sent out an all-campus message indicating that based upon changes in case transmission rates across Nebraska, and particularly in the Omaha metro area, based upon the good information from the rollout of vaccines, and also from excellent data reporting, we are planning for a much more normal or near normal fall semester on the UNO campus. And of course, we're all going through a process of defining what new normal means, but it'll be much more like a traditional campus experience for most, but not all, of our faculty, student, and staff. What we've seen from the fall semester is the amount of case transmission that occurs in classrooms, teaching laboratories, libraries, etc., is essentially zero. And indeed, in the classroom and teaching lab, it was actually zero, in spite of just over 500 total cases we had during the semester, almost 90% of which were transmitted in the community. And so as a result of that message, there have been a number of questions, and so let's just take them in order. The first is, quote, if I have an underlying health condition, or if I'm caring for a family member who has health conditions, do I need to formally document that with HR to teach online or remotely in the fall? The answer to the question is we've had a process in place for all faculty, students, and staff, and we've had it since the beginning of the fall semester, overseen by Dr. Jane Meza in our health security group. Specifically, if individuals wanted to come forward without having to specify what type of health condition they may or may not have, and have a reason that they will need to be teaching from or working or studying from off campus, our goal is to accommodate as much of that as possible and hopefully very close to all of it. As far as what type of documentation process would be necessary, it would simply be a matter of coming forward to confirm that there are these health conditions without specifying what they might be, whether it's the individual member of the UNO family or whether it's a member of the family of any of our employees, faculty, staff, or students. Second question, if I'm unable to be vaccinated by fall semester, either because of lack of vaccines or because of a health condition, will I be required to teach in person? As I alluded to earlier, I don't think anybody's going to be, quote, required to teach in person, or for that matter, be present in person, unless it's a job that requires in-person performance, such as environmental services and several others that, campus security and things of that nature. But the answer to the question is we are not going to be requiring vaccination, at least not in the foreseeable future. And that's for a number of reasons, not the least of which is that the vaccines that we currently have are emergency use authorization certified. That is to say, they haven't fully gone through the FDA process for long-term safety and efficacy. And secondly, it's unclear as to, with emerging strains and variants and mutations of the virus and lack of access to the vaccines, which hopefully will continue to increase over the next 6 months, exactly what percentage of our workforce will be able to be immunized, what percentage of our students, etc. Now, based upon the current trends, we believe by the beginning of the fall semester, the state of Nebraska will be actively immunizing healthy people under the age of 65. But that transition is likely not going to occur till late spring, early summer, and so therefore requirements, I think, will be non-existent. Time will tell. There may be best practices or recommendations we'll roll out, but in terms of hard and fast requirements, I think not. The last question that I wanted to address today is, will there be enough classrooms to reach 60% in-person classes if we need to maintain social distancing by the fall? And the answer to the question is, depending upon what the Centers for Disease requirements are, the CDC requirements, and many of you may know that they've recently shifted from 6-foot social distancing to 3-foot social distancing in classrooms, and that's been based upon the science of transmission in the classroom environment, predominantly in the K-12 systems, but also in higher education. And there is more information that's being processed right now under President Biden's task force through the CDC to continue to advise in an appropriate classroom situation with masking as to what the distancing should be and what safety should be. Rest assured to the entire UNO community, we're going to follow the very best and the very safest practices that are out there. We're going to let science be our guide. And again, we're going to follow very carefully the preferences and the safety concerns that individual faculty, students, and staff may have as we move into the fall semester. But having said that, I will tell you that I am really optimistic that the fall semester will be a new normal, but it'll be a normal situation that'll make our faculty, students, and staff feel comfortable being on campus. Now, there are a lot of provisos. How many vaccines will be rolled out, whether or not these new viral mutations will, quote, escape the immunization or the previous exposure immunity that has occurred. And there are so many other questions that we're going to need to answer. Will we still be requiring masks? What's going to be happening to large group sessions, etc.? All of that's going to change a lot between now and when the first day of class occurs in late August. But I'm optimistic that we'll be back to a much more normal situation. I look forward to taking more questions from you. Please feel free to incorporate them in the upcoming town hall meetings, or if you have specific questions as a result of this communication, please feel free to send me an email, call, or text. Best wishes, and thanks for giving me a few minutes.